Welcome back to Bay Area Focus. Breathe California works hard educating communities about lung health. Jelissa Parham is here to break down their biggest concerns, including e-cigarettes. Thanks for coming on.
Thanks for having me.
Okay, so Breathe California, tell me what the focus really is.
Okay, so Breathe California, we believe that breathing shouldn't be a struggle or a risk. So what that means is that we provide programs and advocacy to the local community in order to educate them and empower them in order for them to live healthy lives.
And part of that is to really get to young people before before they take that up.
Exactly.
Right.
So one of the things that I do is that I work directly in the San Francisco schools and educate youth about e-cigarettes and the risk of smoking. E-cigarettes are something that's a really emerging issue, and there's a lot of misinformation about it. So in terms of getting young people educated and they can empower themselves to make healthy decisions.
Well, a lot of people think that e-cigarettes are a healthy alternative to cigarettes.
So e-cigarettes are definitely not a healthy alternative to regular cigarettes. So 9 out of 10 people that try to quit smoking and that use e-cigarettes to help them quit smoking actually are not able to. So again, there's a lot of misinformation about e-cigarettes, and what we're really pushing for at Breathe California is to have legislation that regulates e-cigarettes just like regular cigarettes.
Why do young people start smoking? I know sometimes it's because they grew up with that in their home, but others, what are the reasons?
So in the schools, a lot of the students that I speak to and I work really closely with, sometimes they're curious, sometimes their friends smoke, but when the initial nicotine addiction hits, then they have a really hard time quitting. So it's something that follows them through their whole life. So between 80 and 90% of people that smoke regular cigarettes now as adults, they started smoking as children. So with e-cigarettes, it's starting the initial nicotine addiction, and so that's a really big problem.
It's strange because when I was younger, it seemed like, you know, smoking was a social thing, and then now there's such a stigma attached to it, more of one, but yet you still have people starting
yes.
up.
So in terms of smoking, the rates, traditional cigarettes, the rates have gone down drastically. However, the rates of smoking e-cigarettes have gone up drastically. So there's been a lot of vape shops that open, hookah bars, different things to make smoking more socially acceptable. So what we're trying to do is to change that trend to prevent people from starting that initial nicotine addiction at the onset.
And then what do you do with people who have been smoking for years?
So we have different classes. It's called Ash Kickers. That is around the Bay Area. And so we give them tools. We also give them classes in order for them to be successful in quitting smoking.
And you also have fundraising events
as
well?
So we have our biggest fundraising event happening this summer on July 11th called Bike for Breath. There's usually about 600 participants. It's in Atherton this year, and it's for families. We have a 10-mile bike ride. We have an intermediate one, 30 miles, and then for the really serious bikers, we have a 60-mile bike ride. So it's a really great event, and we always have a lot of people come out and fundraise and bike the event.
It looks like a great event just from all of those pictures, and it looks like it's a family event.
Yes, definitely. So we encourage people to get out, be active, bring their families, and really just celebrate being healthy and lung health as well.
What is most rewarding about your work?
I think the thing that's most rewarding is that when I get to see people change their behavior and live healthier lives, because sometimes people really struggle with it. And at the end, where they're able to make the decision to be smoke-free, that's always such a great feeling to know that I helped them get there, and Breathe California is working in the community.
And you do such important work, especially lung disease now moving to the second leading cause of death in the U.S.
And I think even now more than before, our work is so important because we want to continue to make sure that air quality is what it should be and people are getting the services that they need.
All right, Jelissa, thank you so much for coming on the show.
Thank you for having me.
And for more information on Breathe California, just log on to ggbreathe.org. Again, that's ggbreathe.org. Coming up, a Boys and Girls Club that's been inspiring young people since 1941.